right at the top of the show. The shortage of the vaccine jab, especially the second dose, and many people, have not been able to register for their first as well. That is now ailing a lot of citizens who even want to get vaccinated. Now, the centre's entire policy of vaccination has come under harsh scrutiny of the Supreme Court, and the way the vaccination drive needs to be sped up, at least coupled with vaccine hesitancy, the politics around it, and more or less inaction from the centre or late action from the centre is causing a big delay. How big is this delay going to cost us in future? That only time will tell. At this moment, take a look at how states are up in arms against the centres when it comes to the vaccination policy.
COVID-19 vaccine shortage, the biggest roadblock in India's fight against coronavirus. With doses running short, the centre and states have trained their guns on each other. Opposition-ruled states are mounting pressure on the union government for centralized procurement of vaccines. Odisha CM Naveen Patnaik has written to all CMs urging them to join hands in the efforts. Bengal CM Mamata Banerjee, Delhi CM Arvind Kejriwal, Jharkhand CM Hemant Soren and Kerala CM Pinarayi Vijayan have already made the same plea to the centre.
केरला का चीफ मिनिस्टर भी चाहते हैं, उन्होंने भी चाहते हैं कि सेंट्रल गवर्नमेंट फ्री वैक्सीन दे और स्टेट गवर्नमेंट को क्यों प्रोक्योरमेंट करने बोलता है. स्टेट गवर्नमेंट कैन नॉट डू इट. इट इज अ सेंट्रल गवर्नमेंट. दे शुड हैव सेंट द वैक्सीन टू द स्टेट गवर्नमेंट.
The BJP-ruled states, on the other hand, have rejected these contentions.
हम लोग लास्ट महीना 13 लाख वैक्सीन मिला था, इस महीना 19 लाख मिलूंगा, जुलाई अगस्त में और मिलते जाऊंगा. तो लोगों को वैक्सीन मिल रहा है और मैक्सिमम लोगों को दिलाने का कोशिश भी चल रहा है.
The Assam CM also trashed the earlier vaccine policies.
कांग्रेस को पूछना चाहिए कि पोलियो में आपका क्या पॉलिसी था कि देश को कम से कम 30 साल का जरूरत हुआ पोलियो वैक्सीन सबको देने में.
The face-off between the centre and the states come even as the Supreme Court in an order termed the Narendra Modi government's vaccine policy arbitrary and irrational. It has asked the centre to submit its vaccine roadmap within 2 weeks. The centre has set an ambitious target. Everybody over the age of 18 are to be inoculated by December end. From mid-July, the government says 1 crore people will be vaccinated every day. A tall order considering India has been inoculating just 17 lakh people daily. This is how the government hopes to achieve it. 10 crore doses of Covishield will be produced each month from July onwards. 3.5 crore more than the current production. 7.5 crore Covaxin doses will be available from July. 6 crore more than the current numbers. 2.5 crore doses of Sputnik are expected to be ready by July. Other contenders like Pfizer and Moderna are also expected to enter the market by July end. While the government appears confident on meeting its target, the opposition is not convinced.
If we give the vaccine to all the people, it automatically will take 6 months or 1 year, because you have to give the vaccination course of people. India 140 course. So without knowing the details, even they are not sending the vaccine to the state government.
Sources in the central government have said that they don't much depend on the vaccines that may be coming from abroad because they will be more expensive to procure. If at all the government ever thinks that inoculation for those above the 18 years of age could be made free of cost. Vijay Thakur, this is Milan Sharma for India Today.
Let me now go across to National Affairs Editor, India Today, Rahul Srivastava, who is joining us at this moment. Rahul, after the centre's scathing remark on the vaccination policy of the central government, there is a very clear divide between the BJP-ruled state and the non-BJP-ruled state. The fact of the matter is, Rahul, so far the government is only selling an ambitious plan. On the ground, things would be quite difficult to even achieve that.
Yes, Ankit. Ankit, given what the Supreme Court has said, that a roadmap for vaccination, it's not an isolated element, Ankit. The entire roadmap for vaccination today is totally linked to the roadmap for the economy. It's a link to the roadmap for the growth in this country. And if one fails, everything else fails. Now, claims are one thing, Ankit. If you look at simple arithmetics, one thing which I would like to explain is that if the vaccination drive is 135 days old, 21 crore vaccinations done or supplied, means the average supply, even if there have been highs of 33.5 million on one single day during the Tika Divas days, the average supply has been 15.2 lakh every day. Now, for getting herd immunity, that is 70% people to be vaccinated in this country by December end, you need to vaccinate 94.5 crore people. That means twin vaccinations means something close to 190 crore vaccine doses have to be arranged. Now, if you see the story we have done and you add up all the numbers, then you are getting a number of nearly 10 to 112 crore, even if this roadmap of vaccine delivery follows till the end of December. That means there is still a shortfall of nearly 80 crores. What we need to do, Ankit, is that if we have to vaccinate 70% Indians by December 31st, then you need vaccinating 1 crore people a day. Nothing else needs to be talked about. Nothing else needs to be arranged. And I think right now the numbers available are terribly short. We know at least there are 10 states in the country, including one of the worst of Maharashtra, where in Mumbai, where there is no vaccination drive today. That is perhaps a telling commentary on the availability situation.
The vaccine availability for 18 to 44-year-old is minuscule in Delhi. There is no Covaxin available. Even Covishield is running out as far as the 1844 group is concerned. But Rahul, very quickly, before I move on, very quickly, do you see this damaging, the kind of comments being made by the Supreme Court? It's not opposition party, it's not Rahul Gandhi tweeting about it. This will have a political bearing, and especially political bearing on the political capital of Prime Minister Narendra Modi.
Ankit, see, there is a cumulative damage happening. What is happening is that first there were a lot of bodies. The second surge claimed a lot of lives. That was a setback. Then there was a setback in terms of the kind of medical infrastructure, people gasping for oxygen outside the hospitals. Then you have got a situation in which you have got people not getting vaccinated, reaching vaccination centers. Remember, this is one side of the story, Ankit. Already the April-May picture is telling that the economy could be taking a hit if the restrictions continue. Still, nearly 50% of India is under very high degree of restrictions. Means economy is going to take a hit, means jobs are going to suffer, means sales are not going to happen. All these are going to add up and create a poor narrative for the central government.
Rahul Srivastav, thank you so much for adding perspective to this very, very important, conversation which is going on the centre's vaccination policy and the impact that it's going to have. It is going to be a cascading impact from vaccination to economy, and all this, if not arrested, could be politically detrimental to the Bharatiya Janata Party in the upcoming polls as well. Now, I want to shift focus to staying with the vaccines, just on the other important aspect that we have been tracking today. The government has indicated, sources in the government have indicated that there could be some sort of legal protection, the indemnity clause that Pfizer, Moderna, the global vaccine makers have been asking India. Now, the government seems to be easing their stand. DGCI has already said that the bridge study is now not required. This could potentially mean an early arrival. Early arrival, by early arrival, I don't mean to say that these vaccines shouldn't have come earlier, but at least at the given point of time, the shortage that we are seeing on that timeline, some sliver of hope as far as the foreign vaccines, Pfizer and Moderna, are concerned. My colleague Sneha with this report.
Security against or exemption from legal liability. Indemnity. That is the demand of US-based Pfizer and Moderna, and after several rounds of negotiations, India seems to be ready to grant these companies indemnity from liability. What does the term really imply?
This is obviously something that's done in emergency situations, depending on your need, the intensity of your need, and therefore you have to offer something extra by way of an assurance, if you like, a legal assurance.
Pfizer enjoys indemnity in at least 116 countries where it delivers the jabs against COVID-19, which means that it cannot be sued for any adverse effects. India has so far not given any manufacturer indemnity against the cost of compensation for any severe side effects. Serum Institute of India too had pushed for legal protection before the rollout of Covishield. It got none. Arguments that Pfizer had to go back because India was belligerent about indemnity and bridging studies have their counter.
One could always argue that retrospectively, if we had done away with the bridging studies in the past and said that you can just approve vaccines with the regulatory approval being there from, let's say, the foreign regulators, we should accept that and go ahead. But then there was a lot of concern that in our own population, we may have side effects which may cause problems which may not get picked up.
Has a severe vaccine crisis or criticism that India has not been a good negotiator brought about a change in position? Or shortage of doses and attempts to close the gap between demand and supply led to a change in heart? Whatever the case may be, the offer of Pfizer to offer 5 crore doses starting July is a tempting one. Moderna too says they can augment their supply but by next year. In a statement to India today, Pfizer India has said that Pfizer is committed to continued engagement with the government of India to support its fight against the pandemic and to make the Pfizer-BioNTech COVID-19 vaccine available for use in the country. This is an ongoing discussion with the government, therefore we are unable to confirm more. In another major waiver, the Indian drug regulator has done away with bridging studies in India for foreign vaccines if they are approved by the World Health Organization, by the US FDA or other credible health regulatory bodies. Experts welcome the move but question the delay behind this process.
Vaccines made abroad such as Pfizer and Moderna have been in use for over 6 months, and these are excellent and safe vaccines of a proven track record. There is really no need to do bridging trials in India because the phase 3 trials of both these vaccines have been published and also approved by the WHO.
We should have capitalized on the large manufacturing capacity of vaccines that India has and finalized the deals with these companies to manufacture their vaccines in India.
India continues to walk a tightrope as negotiations continue and a final decision is yet to be made. Already, sources within Indian vaccine manufacturing companies insist that if indemnity is granted to foreign companies, they too would expect a level playing field. Logistics and management of cold chain supplies from these vaccines could still need to be sorted out. For now, India may just have crossed the first of many hurdles to bring foreign vaccines to India.
Pfizer's storage qualification that requires it to be refrigerated under -80 degrees also makes it difficult to be distributed in rural parts of the country, which is why the central government's focus right now is more to do with enhancement of production of the domestic manufacturers of vaccines in the country, and the government feels that that is where the real difference to India's vaccination drive will lie. With Anisha Mathur and Sneha Modani, this is Milan Sharma for India Today.
Now, the shortage of the vaccines is in a very significant way, which can be monitored, which can be seen on the ground, is creating a huge divide, urban-rural divide. People from cities are in fact going to rural areas to get a jab. The next story that we are bringing to you is from Rajasthan. And even in this urban-rural divide, in the face of very little sanitization drive, or a drive to in fact tell people, dispel their fears as far as the vaccination is concerned, misinformation, the tribal areas of Rajasthan are bearing the brunt. People, because of the shortage and also because of misinformation, there are unable or are not willing to get vaccinated, which could be the next big challenge for the state government and, of course, the country as a whole. Take a look at this report from my colleague, Maushmi Singh.
Southern Rajasthan.
nestled in the Aravalli range. Home to Bhil, Meena and Garasia tribes. Despite relative isolation, the pandemic made way to these hamlets of forest dwellers.
In western Rajasthan, located amidst the Aravalli ranges, is the Sirohi district, which is got a dense population of the tribal people. But like these babool trees, the life of the tribal community is full of thorns. Is the awareness reaching to the remotest parts of this district? We'll try and find out.
A walk through the dirt track